Hi, it's Dr. Sharon. Seems like I'm always messing with my hair. Let's see who's gonna come on. It's Dr. Sharon. I'm in the back of an Uber on my way to an event. So why not do a Facebook Live pertaining to the event? So hopefully someone's gonna come on soon. But as you know, I will always, hi Tony, I will always post this video. By the way, hey Nikita, what's up cuz? There's another cousin. Kim, what's up? Hi Ruth. North Carolina is in the house. Y'all, I gotta come home soon because I miss my family. Tell my Aunt Rome I said hello. Again, it's Dr. Sharon on my way to a women's health gala. I'm very honored to be going, and of course I'm a little tardy, but what else is new? Hi Carl. But I titled this, I'm coming home soon, so y'all have some croaker for me. I see my Kannapolis crew. There is no fish like croaker fish fried outside. I'm sorry. I ate all around the world, but nothing is like my people in North Carolina. My aunties know, they know how to throw down. So I want to talk to you guys a bit about, since I am going to healthywoman.org has an annual event in Washington DC. I'll be at the Italian embassy in a few minutes, hopefully soon. Fortunately, I got Uber, so I can do this as we go. So that's what all the bouncing is about. But I want to talk to women, and I love giving this talk around the country, talking to women, real talk about what we have to know and what we must do for our health. But men, you stay tuned too, because if you have a mother that's living, an auntie, anyone, if you have a woman in your life, one of the things that you should do is make sure that women in your life, take care of themselves. So let's hit some quick topics. You all can ask questions all during the Facebook Live. I love your questions. And I got several emails today based on another event that I did. So let's hit it. So women, let me just tell you the truth. We are more than breasts and our vajayjays. We are always talking about women's reproductive health, and that's very important. Hi, Maggie. That's very important, but sometimes we get lost. The leading cause of death in women, who knows? If you've ever heard me talk, you know, because I say this all the time. The leading cause of death in women is actually heart disease, not breast cancer, not uterine cancer, not that. It is heart disease. So sometimes when you talk about women's health, people only want to talk about having babies, not having babies, menopause, and all of that is wonderful, and I'm going to hit on those topics. But I need you to do the basics. Somebody say basics. The basics are, number one, the reason why women will leave this world, number one, and that's for all people, men too, is heart disease. And people tell me all the time when I do talks, oh, I don't have heart disease. I have some high blood pressure. Baby, if you got high blood pressure, you have heart disease, sweetie. Okay? Heart disease is not that you just had a heart attack. If you have high cholesterol, you're at risk for heart disease. If you have diabetes, you're at risk for heart disease. Okay? So, and that's a little bit deadly. Okay? So number one, heart disease, anything that affects the heart. Let me break it down for you as I do. The heart is the master pump of the body. Boom. That's it. It is the master pump. If the heart stops, we have to start it back. There's two reasons the heart stops. One, it stops getting blood and oxygen to it. All right, that's clogged arteries. That means we're eating too much pork, we're eating too much fat, we have a genetic predisposition to that, all of that. Or two is that you have a blood clot that kind of breaks off and blocks the artery. That is basically a heart attack. A heart attack just basically means that oxygen and flow have stopped going to a particular part of the heart, and the heart is literally under the attack. The heart is about this big, the size of your fist. Larger hearts, enlarged hearts get bigger, but the heart is a muscle. It is a muscle. So that's why when we tell you to exercise, we want you to exercise the muscle of the heart with cardiac health and all of that. Okay, so cardiac, walk, run, do something. So 2, and I'm trying to make this quick but make you understand. 2, you can also have a heart attack, and it's really not a heart attack, but the electrical currents go through your whole body. Okay, so if you have what's called an arrhythmia, it's a big medical school word for, you know how you plug in something, you get a little spark, right? Or the electrical current doesn't go all the way through. Your heart has electrical current. The heart sounds like this: lub-dub, lub-dub. If you have a murmur, and many women do have low-grade murmurs because we have issues with fibroids and maybe have less blood going, then it is lub-dub, lub-dub, a little bitty whisper. Hey, Mike. So that's what a heart murmur sounds like. But also, if you have, and you see in the movies when people grab their chest, they fall on the ground and somebody gets on top of them and starts to pump. If you take your fist and punch the heart, literally you punch the chest, it is to interrupt that electrical current and try to get the heart started again. We also have defibrillators and those things to try to get that current going back through the heart. Hi, Denise. Uh-oh, I got docs on the line. I'm a little scared. Hi, Kelly. Hi, Gerald. So, 1, heart attack. How do you prevent heart disease? Number 1, it is a lot of our diet and exercise. Prevention is key. If you have high blood pressure, your goal is to have your blood pressure less than 120/80. Somebody say less than. I want y'all to type that. Less than 120/80. I have been saying this now for years and years and years. And inevitably, I was given a talk about 2 weeks ago. Someone challenged me and said, well, no, my doctor says my blood pressure is 140/95 and it's never going to get lower and I'm taking all these medications. Your goal is less than 120/80. Okay? So, and it's not just heart disease and heart issues that affect high blood pressure. Number 1, if you're feeling very tired, right? If you are pumping against pressure all the time, you get tired. And so fatigue is one of the symptoms, and we call it the silent killer. But actually, heart disease does have some symptoms. People say, and my mother says all the time, oh, I know my blood pressure's up because my head hurts. And then I tell her, well, no, really, if it's that high, we could be in stroke. We could be in stroke area, okay? So, the other issue is you feel bad. There are other complications, kidney disease, and particularly minority populations, African Americans have the highest rates of kidney disease of any other population. And part of that is because we have high rates of diabetes, high rates of high blood pressure. So tonight's topic is what women should know about our health and what the men who love us should know about our health. So number 1, high blood pressure. If you smoke, stop. There is nothing else as a physician that I can say. Denise Gooch is on. So Denise, if you got something else to say as a physician about people smoking, you say it. Can anybody tell me one good thing that comes from a cigarette? Plus, you got to be rich now to smoke because it costs so much. But also, if you do smoke, your skin gets dry, you have lines all around your lips, and more importantly, you are at risk for heart disease, and you're at increased risk for lung cancer, throat cancer, every cancer known to man. And so I say that stop, but I know it's an addiction. And so there are things that you can do to help stop smoking. So, and this is good information for men too. So my whole heart disease spiel, heart attack, stroke, high blood pressure, high cholesterol, all of those, and what's called arrhythmias are all issues associated with heart disease. I'm in the back of an Uber on my way to a healthy woman gala, so I'm talking about women's health. I hope y'all repost this. So number 1, heart disease. What else should women know? Again, we are not just relegated to our breast and our vajayjay, all right? Because sometimes that's all we want to talk about. Menopause, having a baby, fibroids, all that. And all that is good and whatever. But we have to talk about other real stuff. 2, diabetes. Particularly African American women, of all the women in the world, African American women and Latino women have the highest rates of diabetes. Okay. What's up, Colette? Reverend Colette, it's time for lunch. So we have to get it right. Now, what is the number one reason why we get diabetes? We eat too much and we don't exercise. So if you want to combat high blood pressure, you want to combat high cholesterol, you want to combat diabetes, number one, it's with the fork, number one, because you cannot out-exercise a bad diet. Number two is that we need to exercise, and you don't just exercise to lose weight. Number one, head to toe, your mental health, your physical health, your endurance, okay? Hi, Episcopal Supervisor Hall Reed, you do that for those things, right? You exercise because it is good for you, and it is the right thing to do for you. I'm telling you, give me 2 weeks of exercise. I dare anyone, I will send you a gift. If you honestly tell me after 2 weeks of exercise that you are not feeling better and you're being honest about it, email me and say, Dr. Sharon, you lied, and I will send you a gift, all right? I will send you a gift and say, hey, I'm wrong, but you got to really do it, right? So is it 15 minutes? If it's 20 minutes, I need you to do something, because that will help you, number one, with heart disease, will help you with diabetes, will help get your cholesterol down, all of that. So blood pressure less than 120/80, cholesterol levels, your total should be less than 200, your bad cholesterol, which is the LDL, should be less than, we really want it to be less than 80, but we'll say less than 100. And your HDL, which is, you got to have cholesterol, as I've said before, but your HDL is what protects the heart, okay? So that should be greater than 50, and most of us are saying over 75. So heart disease, diabetes. Now, what every woman should know, now let's move into cancers. I'm emailing anyway because you are the best gift. Shut up, Michael. Okay. My friends are the worst people to watch this. Yoga is great. Maggie Green, yoga is great for lowering blood pressure and for kind of keeping things calm. So now, other things. Let's hit the big C word. Many of us, thank you. Many of us don't want to talk about cancer. Cancer is simply this. If you've ever heard me talk, I've said it over and over again. It's simple. You ain't got to go through all these big words. Cancer is the cells in your body go crazy. You know how you got some crazy cousins, some crazy family members, brothers, sisters, whatever, and just one just ain't a little right? That's what happens with cancer. Cancer is not a fungus. It's not a bacteria that invades your body. It is that one of the cells in your body goes a little crazy, and then it gets some friends that go crazy, and that's a tumor. That's it. All right? So when it's lung cancer, there's a cell in the lung that went crazy, went a little different, and then it gets some friends and becomes a tumor. Breast cancer, again, one cell that is in the breast goes a little crazy, gets some friends, and then it's a tumor. That's all cancer is. How do you get rid of cancer? Number one, if I don't say anything else, and you all know I'm a national spokesperson for the American Cancer Society. This is so near and dear to my heart. I literally am able to train thousands and thousands and thousands of people every year that now train thousands of other people on how to really talk real about cancer. One, it's not a death sentence. If we can catch cancer early, most cancers, if caught early, have better prognosis. Literally all of them do, but most of them. And go back to healthy living. It is now summertime. Many of us are going to be at the beach. You need to be wearing sunscreen all the time anyway, but you need to slather it on if you're there more, because everybody gets sun cancer. We think that that's a white disease or a light skin disease. Well, no. Actually, African Americans that get skin cancer, I said sun cancer, but it's skin cancer, actually have worse prognosis. So you need to protect yourself. Two, eat more fiber for all cancers. Low-fat diets, fiber foods, we know has a direct impact on breast cancer, colon cancer, and other cancers. So a healthy diet with 5 fresh fruits and vegetables a day. I've talked a lot about antioxidants. Again, for those of you who just came on, I'm on my way to a gala, so why not do to a healthywoman.org gala. Why not do Healthy Women right now? And so, but these are things that are good for men too. Fresh fruits and vegetables. Your mama told you to eat some roughage. Your mama was right. you need roughage, especially when we talk about colon cancer, okay? So we know high-fat diets, low activity, low exercise puts you at increased risk for cancer. I will talk a minute about colon cancer. If you have to get a cancer, one of the quote-unquote best cancers to get and get caught early is colon cancer. Because when they do the colonoscopy and they go through the colon and see a polyp or they see a cancerous lesion, cut it off, usually you're pretty good if they catch it early. It's only when it gets bigger, and that's with all of the cancers, that it gets bigger, that we now have a problem. And wouldn't you want, say you got a little deficit in your little checking account. Say you negative $2. Do you want to be negative $2 or you want to be negative $500? I try to keep it real, so we all of us done had a deficit in the checking account. So you want to catch that $2 problem versus a $500 problem. That's what early detection is, people. Okay, so now, leading cancers. Number one, when you talk about women, breast cancer, number one, deaths from cancer, lung cancer, hands down. 2, breast cancer. But if you catch breast cancer early, the prognosis is so much better. Please get your mammograms. Please do your self-breast exams. As I say, it talks all the time for men. If your man is examining your breast, that is not a breast exam. That's called foreplay. But men have found breast cancer in their significant others. You know, that's a little joke, but I'm actually telling the truth. Also, women, if you are, doing your thing and you feel a lump on your man, men can get breast cancer as well. So breast cancer, key is early detection. And question I have now, because I will interrupt what I'm saying for your questions, are fiber supplements, powders, good? They are, but I'd much rather, Nikita, that you ate an apple, that you ate some fruit, that was, oh, my niece is on, hi Didi, that you ate some fruit. But yes, fiber supplements are good. And there are tablets actually that I love to take that are sugar-free, that are good. Fiber supplements are fine, but make sure you're eating your fiber. Collard greens are full of fiber. You just don't put pig in it or turkey in it. You have more meat in it than you do fiber, okay? So now, talked about breast cancer. Colon cancer actually occurs equally in, that's right, have your man do the breast self-exam. You have some fun afterwards. So colon cancer is number 3 as it relates to men and women. Of course, men, as it relates to men and women get colon cancer. We often think that colon cancer is a man's disease. It is not. We just think, because the prostate is there, the colon is there. Prostate cancer is something else. The prostate is a gland right behind the penis. And I'm about to have an accident in the car with Uber. Y'all pray for us, sister. I'm about to have an accident. That's okay, dear. Just get me here. Okay, Italian embassy, where we at? So anyway, so when we now talk about colon cancer, it is important at 50 that you get a colonoscopy unless, everybody say unless you have colon cancer in your family. One of the cancers with the biggest connection to family history is colon cancer. And listen to this, because some of my cousins are on, my niece is on. And we don't have colon cancer in our family that I am aware of. But then we all don't talk about all the stuff. But if someone has colon cancer, you need to get screened earlier than 50. Literally at 35 to 40, you can get screened. But you need to tell your doctor, and you need to return the school cards. I do recommend, and there are all these recommendations for colonoscopies and all that, flexible sigmoidoscopies. I'm going to tell you what I do. Get a colonoscopy. They look at the whole entire colon from the rooty to the tootie. And if it's fine, you have to do it every 10 years. If you get what's called a flexible sigmoidoscopy, you have to do that every 5 years. I'm saying if you got to go up in there, and I'm going to be all right, I'd rather you go up in there one time, be all right, and then 10 years later I come back. And typically that is after 50, okay? So now, we talked about colon cancer. We talked about breast cancer. Prevention, and early detection. Get your screening test. If you don't know what you should be screened for, email me. I'm very responsive. My staff will send out something, or go to American Cancer Society site. They have great information. Okay, now, the other thing that women should know about our health, now as we move down to the reproductive organs, it seems like our lives are cut into pieces. We are before puberty for our little girls that haven't had a period. Then we're after puberty. The moment your child has a period, she can get pregnant. All right? As long as she's having sex. And you should have the discussion about your period early on. There are young women, excuse me, I got a little shaken by that little car thing situation. There are young women who actually have periods and think they're dying because their mother or their father or their significant, whoever is raising them, has not talked about a period, right? It's not wrong talking about a period. It's natural, okay? But you really need to have that discussion. Aunt Vanessa wants to know what else is enriched with fiber. She doesn't do greens. Anything that's roughage and grows out of the ground has fiber in it. That's a great question. Apples, fruits, berries. Berries are great for your skin. They're great for fiber. All of that. Green beans, that stuff. All of those are great fiber foods. So, talk about periods. And then we need to talk about, I have a national initiative around uterine fibroids, which I'll be talking about more in a little bit. Not at this Facebook Live, but uterine fibroids are little tumors that are non-cancerous that grow in the uterus. If you have heavy periods for a long period of time, clots and all that, you may have uterine fibroids. It does not put you at an increased risk for cancer, but it can cause you to be anemic, your blood counts drop. And one of the things that I was talking about even yesterday is men, and how do you deal with your wife, your girlfriend, whoever having uterine fibroids, because it does affect you as well. Okay, but that'll be a whole nother Facebook Live. We talked about reproductive issues, and sometimes we've kind of assumed that, everything's going to work. There are 2, 3, 4, 5 reasons why you would not be able to get pregnant. One, if you have diabetes, it's going to be a little bit harder. If you have other types of what we call endocrine disorders, it'll be a little harder. Obesity, okay? If you are obese, it is harder to get pregnant. And then you can have issues where you have fibroids and your tubes are blocked. Okay, so the uterus is where the baby is carried. There are tubes coming off the uterus, which are the fallopian tubes, and then it goes to the ovaries. The ovaries are where your eggs are. You are born with all the eggs you ever gonna have, right? So when that egg gets released, it goes down the fallopian tube, goes and sits in the uterus waiting to get pregnant. Now, men, I'm gonna tell you this. We get tired of y'all saying all of our emotional issues are around our period, or then after we go through menopause is around our menopause. As I say to audiences all over, sometimes it ain't got nothing to do with that. Y'all just getting on our nerves. That's it. That's all. It ain't got nothing to do with our period. She emotional because that time of month, whatever. Yes, we do have mood swings, but so do y'all. I'm going to do a whole Facebook Live on men's menopause. I am, because I do believe y'all have some issues. But, so, now, what happens when we talked about puberty? We talked about the reproductive years when the body every month is releasing an egg and it's waiting to get pregnant. When it doesn't get pregnant, the body says, okay, let's get rid of this uterus lining, all that. That's when your period comes. Now, then you get to perimenopause. Perimenopause, do this. Ask your mother if she's alive. When does she go through menopause? Ask her. If she didn't have surgery within a year of when she went through menopause, you will really go through menopause, okay? Same thing when your period starts. The Bible says, I think in Proverbs, that as is a mother is her daughter. Yeah, my mom used to not like that because she was like, she ain't like me. I'm nicer. But anyway, I'm just playing. No, she didn't really like that scripture. But anyway, within 1 year of when you start your period, your mother has basically started it within a year, and that's a hormonal connection. Not 100%, but very, very close. So menopause, what happens? The body says, I don't know if I'm supposed to get pregnant or not, so it goes crazy. I don't know if I'm supposed to have this estrogen, so I'm gonna grow hair in these weird places, right? My hormones are going to go up and down. My emotions are going to go up and down. I may start flashing because the body is saying, let's shut this bad boy down. The baby factory is closed, right? And that means your hormones start to teeter out, and that's what the menopausal symptoms are. There are women that never have menopausal symptoms. God bless you. But most women will feel something. So what every woman needs to know, there are phases in life, right, that you go through. We've often connected them through where we are in the whole pregnancy thing. Can we get pregnant, pre-puberty, puberty, and then reproductive years, and then post-menopausal years, that stuff. It is important for you as a woman to know, again, that you are not just your ovaries. And then we have issues in not just our reproductive organs, not just our heart, not just diabetes. We need to make sure that our bones are in shape. When you have a woman that was 5'9" in her heyday and now is 5'4", she typically has osteoporosis, or she's had some fractures in her back that have made her lose height. And that is important because as you start to lean over, your lungs don't expand as well. You're at increased risk for fractures. As I said in the last 2 Facebook Lives, a woman that has a hip fracture or a man that goes into the hospital, 50% of them will not come out alive. That's deep. So we need to prevent that. Calcium and vitamin D are things that we need to do, as well as exercise and other things to really make sure that we try our best to prevent osteoporosis. Now, osteopenia is weak bones. Osteoporosis is the disease of weaker bones. How close are we to the Italian embassy and my little gala? 8 minutes. Okay, so I got to wrap it up. Again, shout out to healthywoman.org and this Women's Health Gala tonight that I'm on my way to. Okay, so we talked a lot about what women need to know for their bodies. Now let's hit what we really need to know. 2 things. I'm going to save cosmetics till last, because that's what many of you want to know. I get those questions all the time. But one is mental health. With all of the things going on in the media around suicide and high-profile suicides, this is real. I did a whole piece on stress and what stress does to the body, what depression does to the body, what bipolar disease does to the body. For our young women and women, actually college age, ADHD, and that's attention deficit disorder and hyperactivity. You still can be diagnosed even in your teens. This is important. We have a lot of young women getting ready to go to college. Anxiety disorders start to pop up now. They've been at home with their family all the time. You need to have this conversation. And there's no shame in your game. You better talk to them and talk to them real talk. Hey, how you doing? Feeling down and depressed for over 2 weeks, not wanting to get up, not wanting to get out of bed, not wanting to do things. I like to ask people this, and ask yourself this: what do you like to do? If it takes you a long time to say what you like to do, that's a good sign that there's something not quite right. You can ask me what I like to do. I like to eat, I like to shop, I like to laugh, I like to do other stuff, I like to listen to music. Quickly, right? When you have a loss for kind of things that make you happy, or things that give you pleasure, those are signs and symptoms that something is not right mentally. And so mental illness affects absolutely every part of the body. So what women need to know is also have a mental health checkup. Have a discussion. And if you need to see a therapist, you need to see a counselor. You know, your girlfriends are great, but they're not professionally trained in most cases. So you need to make sure that you get it checked out, and make sure that our young women, you're checking them and talking to them about mental health. It is time for us now to get rid of the taboo of mental health. Talk to our daughters about the issues that they face. Talk to them. As I said, I think around school shootings, I don't know what it's like to go to school and have to go through a metal detector. I don't know what that's like. That wasn't my reality. And so have those discussions. Those are major things for women's health. Please go back and check it out. We're about to have another little issue. DC drivers ain't no joke. I'm in the back of Uber on my way to a gala. All right, so those are the things that we need to talk about. We're about 4 minutes away. I got to redo lipstick and try to get together. But men, this is what you need to know about women's health. That they have done what they need to do. When is the BWI, when is Beautiful Woman Conference? Stay tuned, but we coming back to North Carolina. All right, we coming to North Carolina, cuz I'll let you know. But men, again, take care of yourselves. And I said this at a talk recently, and I said it years ago, but I've said it more recently. Men, especially men with daughters, with wives or significant others, we want you to be around. So help my hell. Right? Help my health by you keeping yourself healthy. The insurance policy is good, fine, but nobody will want that. We want you, and we want you to be in good health. And if you're having mental health challenges, if you're having physical challenges, work it out and get the help you need. Your wife, your mom, your sister should not be your secretary telling you to go get a prostate exam. Just saying. Or reminding you about your health. It is up to you. And one big nugget is, we know that men that die prematurely and are married or have daughters put their families at risk. They put their wife and their daughter at risk of molestation and rape, and their sons if they have young sons in the house, because you have now opened the door to a predator that will come in. And usually men, real men, are like, oh my God. So I am wrapping it up. I'm going to a Healthy Woman. Shout out to healthywoman.org. They have great information. I'm on my way to the Italian Embassy for a dinner tonight. If this thing don't stay around, wanted to just hit some quick things about women's health and take care of you. If you haven't done your breast exam this month, tonight, as a result of this Facebook Live, do your breast exam. Also schedule your mammogram. I got something in the mail reminding me to schedule mine. Also schedule time with your primary care physician. Every woman needs a blood pressure cuff at the house. Get checked for diabetes and stay on top of your health. This is Dr. Sharon Allison Ottey. Glad you shared some time with me. Please repost, please, because you really, really will help the people in your circle. And also like the Beautiful Woman Inside and Out page. Hi, Frank. Hi, Joyce. Hi, everybody. Thank you for tuning in. But do now the other thing, and that is repost this video and share some information about women's health. I'm getting ready to go salute some women who are doing great work in women's health at the womenhealth.org's annual gala. All right, let me redo some lipstick real quick before we go in. Bye-bye. Thank you.